All right, thank you for staying with Citizen TV. It's a Monday Town Hall report. We're giving you a chance to ask the questions. Dr. Mwachonda Chibanzi is with us, Secretary General KMPDU. Seth Panyako, Secretary General Kenya National Union of Nurses, is also with us. Let's play your questions that have come through on video before I read some of them online.
How would you want Wanjiku or the common Wananchi to chip in the fight for your rights? Because I am one person who believes that if the challenges facing the frontline healthcare workers are solved, health for everyone will improve. Thank you.
We appreciate the work that healthcare service providers have done ever since the pandemic hit the country. But is it fair for them to strike when the country really needs them? Don't you think that is going to be a disadvantage for us, the common Mwananchi? Thank you.
I'm a clinical officer from Busia County. I'm asking, why is it that they are not pushing so much for the establishment of a health service commission that will deal with the issues of human resource in the Ministry of Education?
Mwachonda, I'll start with you. Very brief response on all the three. Citizen support, the issue of strike which will affect the common Mwananchi, and HSC.
The citizen support.
Yeah.
They want to know how to help.
Mm-hmm.
You have 20 days in which, if you support us fully to make sure that the government resolves these matters that we've raised, then there'll be no strike. Because once everything is resolved comprehensively and with your support, then you will have averted this strike. I think that would also answer the second question that was asked.
Yeah, the second question was about whether the common Mwananchi is the one who will be hurting, not even the people you're going against.
The common Mwananchi, there's something called active citizenship, and that is what we, even as KMPDU, are doing. Active citizenship is coming out whenever there's a matter and addressing that matter and asking that the matter be addressed. So for them, if they're really worried about their plight, the same way we are worried about our plight, we ask them to support us in calling the government to resolve these matters. Because at the end of the day, should these matters not be resolved, we are going to walk into a very difficult situation. There is no country that has survived a war in which the frontline doctors or the frontline soldiers have put down their weapons or have died in numbers, and therefore we are all exposed. That would have lost the war to COVID-19. On the last question of the Health Service Commission, we have had perennial challenges in the health sector on human resources for health. Over 100 strikes in the last 7 years. The Health Service Commission historically was in the Bomas draft. It was expunged in Naivasha because people felt that we did not need a Health Service Commission. We had too many commissions. So the question is, between the youth and the health sector, let's not look at votes here. Let us look at issues and reforming the sector. Who needs a commission? And I'm not saying this that it is not important. If they still insist they want a youth commission, let them think about it. But for us, what we want is a health service commission. And let me not say this, and just to say it to the citizens.
Yeah.
We are willing as KMPDU to start, and we shall do this, our own independent constitutional petition just to have a health service commission. One issue only. And we'll ask Kenyans to support us in this. We'll collect those 1 million signatures and present our petition for a constitutional amendment for a health services commission. One thing only.
Okay. Let me bring in Panyako on this. Panyako, you know, earlier on today there was a meeting between the CES for Health, Mutahi Kagwe, and the National Emergency Response Team. They had a meeting today. What would you have wanted to hear from that meeting? Panyako, I think you're on mute. Kindly unmute first.
I'm saying sometimes how government operates really puzzles me. You know, the issue of comprehensive medical insurance for health workers is an issue that we started discussing from the first day the first case was discovered in Kenya. The issue of group life insurance to compensate for the health workers who die in the course of duty is the issue that we are discussing. And we were told when we were on strike and the strike was told by the court, we were told the cabinet had approved. So when I hear the cabinet secretary telling us today that the cabinet approved, he should be telling Kenyans When did the cabinet approve establishment of comprehensive medical insurance for health workers? When did it approve the establishment of group life insurance for health workers? And why has it not been implemented? Why is it that the 16 nurses who have died have not been compensated? I want to respond to some of the issues raised by the Kenyans in terms of how they can come in, how they can help to ensure that the strikes don't take part in this country. Number one is that they must come out clearly, even when they have hold even demonstration within these 20 days. Tell the BBI proponent that, hey, look here, have a break. Just stop within, have 2 days to reflect on what we can do in the health sector so that the poor Kenyans cannot continue to die because of the problems in health sector. Let them tell the president. Let them tell Honorable retired former Prime Minister Raila Odinga. Let them tell them, just have 3 days only to reflect on health sector and find out whether this health sector, the Health Service Commission, can resolve the problems we have or not. Let me tell you, Wananchi, that we are the service providers, but we are unable to get those services when we fall sick. Today, I have a nurse who is in ICU in Kakamega. To manage a nurse in ICU in Kakamega, you need roughly between 40 and 80,000 per day. This is a nurse who's on a DPS contract in Bungoma, and she's earning 25,000 shillings per month. When you deduct, she takes home around 18,000 shillings. Where will this nurse get almost a million by the time she's being discharged from Kakamega ICU? We cannot afford our own services that we are giving Kenyans. Number two, when you go to a private hospital, because we don't have a medical cover, you are asked for 100,000 shillings for you to be admitted. Where do we get that deposit? You saw a nurse who died, was being transferred from Isiolo to Kenyatta University Teaching and Research Hospital for ICU. And yet we are being told that county governments were given 5-point-something billion to equip their health facilities, at least to have an ICU, to have 300 beds. And yet we have a nurse who is dying on transit from Isiolo coming to Nairobi to get ICU facilities. We are saying that we are Kenyans.
Yeah.
And I am one of the people who has suffered because of an industrial action. In 2012, I lost my father because we were on strike. There was no public health facilities that were working, and my father was poor. We could not afford a private hospital, so he died in a public health facility. So when we go on strike, I know what it means to go on strike. We don't want to go on strike. So it is upon the Wananchi to come out. Ombicha, I will tell you something you may not maybe know, that I tested COVID-19 positive.
Yeah.
And I have been on in-house quarantine for 14 days that lapsed yesterday. I did my follow-up test today. The result will be coming out tomorrow, but I know I'm negative because I'm okay, I'm healthy, I have no problem. But what am I trying to say? I have not received any phone call from the Ministry of Health to follow up on me. Now, the issue of home-based care has collapsed.
Yeah.
There's no contact tracing. No one has called me to ask me, Panyako, whom did you come in contact during this time? Because I'm a leader, I come in contact with very many people. But no one has actually asked me what has happened. I can tell you for free that the government has abandoned health sector. The government is not people. The priorities of the government is not about the service to common Wananchi. It is lies somewhere else. Okay. And that is why we say we want to correct that by waking up this country and saying, look here, we are tired. We cannot. Let me ask you on picture. Look at these 3 groups of health workers, the BSN interns who are working. They are actually employed by the government. They have not earned for 2.5 months. Yeah. Look at these contracts who are earning 15,000 shillings and they have not earned for 3 months. Look at Homa Bay, the whole county. Yeah. They have not been paid salary for October. And somebody somewhere is telling us be patriotic. Patriotic for what? Patriotic when we are dying. We become patriotic so that we die. We are saying patriotism must start with the government itself.
Okay. Dr. Mwachonda, there's a tweet here from Zalfa Zani. She says it is understandable the plight of doctors. However, it will only sink in when you're affected negatively. I lost my brother during the doctors' strike, and to date I still can see the face of the doctors who refused to attend to him. I am heartbroken.
Trevor, let me say this. And I'd like to tell her that I'm really sorry if she lost her brother. But let me say this. We have never gone on strike and told doctors when a patient comes, don't see. In fact, when we go on strike, most of the times, out of the situation that comes, because then we are left with no other option, it's a last resort, doctors are never in facilities. So, and if a doctor is in a facility, and Trevor, I'll tell you this, these strikes are not things that people should think that we really want to go on strike. I know what it means, because I myself has been in a situation where doctors have not been paid for 4 months, and a patient comes into the facility and requires help, and I've had to help, even as an official at that, I've had to help that patient myself. So I don't think there's a doctor who would say go away because you're on strike. If you come, you'll be easy. If that doctor is in the hospital, because most of the times the doctors will stay away, because we know what it means. You cannot say you're on strike and walk to the hospital. So basically that's what I'm trying to say. But strikes are because you have pushed us to the wall. The government has pushed us to the wall. Remember Trevor was here 2 weeks ago. And I told you if one doctor dies, what you're going to see is a reaction that will trigger an industrial action, because already there was frustration to so many other issues, and that these issues we had tried to resolve through many other channels. But what happened? It wasn't one. It has been 6 doctors in the last 2 weeks.
Yeah.
So this decision is a painful decision, and we understand the risk. And that is why we are calling, and that is why we're calling upon the government and the public to support us, for the government to make sure that everything that is on that strike notice is resolved. And I'll say this to the governors. Citizens need to ask the governors why they can pay a salary and not remit NHIF dues to NHIF, and a doctor and their family fall sick, they go to a facility, their card flags red, and they have to chip in out of pocket. And sometimes these doctors have very sick relatives or even their children, and they have to pay out of pocket for that. Governors must stop lying to Kenyans with this showbiz. I have an isolation center, I have an ICU center, I have equipment, and yet you lack the requisite personnel. You do not take care of those personnel, you don't pay them in time. And let's stop this blame game of National Treasury has not remitted funds to the national government. We know what happens in these county governments. Sometimes monies for salaries are used elsewhere, so that they request for monies because they know recurrent expenditure is money that cannot be withheld. So governors must equally stop lying to Kenyans and be responsible and accountable for the service that they took an oath to offer to the citizens in those counties. COVID-19 has affected so many governors. The chairman of the Council of Governors is in his county. How many burials? The doctors, Kakamega. 200 million in an account for COVID not spent. Why? And that's just one governor. So many governors got money for COVID, they've not spent it. There are no isolation centers, there are no ICUs, so many, including even our own doctors. One of them died because they were being moved from one county to Nairobi just to get the service that the governors are saying we are ready. There's nothing like 8 months for you to prepare. Honestly speaking, Trevor, we are not being serious as a nation.
So now we are here now. So Seth Panyako, I'll start with you as we wind up on this conversation. How do we avert this looming crisis?
I think you have heard my friend Dr. Machonda very clearly that the issues they have raised in their strike must be addressed in total. And the same applies to the nurses union. We have already given an advanced signal to the government that we intend to give a strike notice, and we expect the government to engage within 7 days before we give a strike notice. Our advance to the government went today. On which it's very frustrating when somebody says about I'm talking about things that are happening that you can know. When you go to accounts like Vihiga County today on Bicha, we have health workers who have worked for 13 good months. 13, 1 year and 1 month without a salary. And you are a governor, you are earning salary yourself. For 13 months, you have health workers who are working and they are facing COVID-19, and you expect them to come and work every day, and you expect them to buy food supplements to even so that they can boost their immunity against COVID-19, and you have not paid them salary for 13 months. What kind of government is this? And that is why we are saying we no longer want to be used as guinea pigs. I think somebody threw health workers to the county saying, go to the county so that you can be killed by governors. We are telling you, health workers are human beings. We are not going to allow our rights to be stepped on day in, day out. Our colleagues, 13 good months, they have not earned salary, and we are in Kenya. What kind of government is this?
Okay. Let's bring up some of this response that we're getting here. There's a lot of it coming through. Let me sneak them in before I come to Dr. Muchonda for the final remarks, because we really ran out of time. Let's bring them up and see what they're saying right now. Edwin Nyakweba says, for health system to function in Kenya, it needs radical surgery and radical views, like constitutionally compelling state officers from the president to MCA in their kins to consume public health services. Until then, sadly, it's just a mirage. So they need to consume the health services that they have to go through. George Ombwak says, a clinical officer, a doctor, a nurse is expected to attend to obviously symptomatic clients without PPEs. Is that patriotism or suicide? All right. Kipsolo Kandie says, I think it's highly insensitive of the doctors to call for a strike at the time the country is battling increasing COVID-19 cases and deaths. Who will call for a strike for the over 1,000 Kenyans who have succumbed to the disease?
Trevor,
yeah, go ahead.
The founding fathers of this profession said that physicians are the attorneys for the poor. And it is within our jurisdiction to advocate for the poor who have no access to healthcare services and to solve the social problems, and in this matter, the health social problem in this country. That is why we have KMPDU. Our mantra and our motto is healthcare is a right. And I'd like to say this, that this strike can be averted because there's nothing that is extraordinary as a demand on the notice. These are things that can be resolved in a very short time. We'll remain available for the next 20 days. We'll sit down with government. We met them today. We'll continue sitting with them for as long as they resolve these matters. But if we'll start intimidation, if we'll start threats, and I said this yesterday, we've already drawn the line. It's our lives that will matter here. If the courts will try to subdue us, there's only one option. We go back to work, we die, or we stay home and we survive. And this narrative that doctors are getting COVID in bars, in social places, in the community, if that is the narrative that is going to run through, then we'll stay home, then we'll see how many will get COVID. Because if there is any single individual in this country today who is at the highest risk, it is a healthcare worker, it is a doctor who leaves his home and walks into the facility where any patient who's coming right now because of the widespread community infections is a high risk for COVID. So the reality is that the line has been drawn. It is our lives.
You know, Muchonda, I still find it perplexing that you met the government officials today. You're saying nothing came out of that discussion?
Trevor, as I said, they had our issues. They wanted to hear what the issues are. We shall continue meeting with them. For as long as, have you seen any documentation that says this is the comprehensive cover for healthcare workers? This is what it will do. Have you seen any?
The CS mentioned NHIF.
No, have you seen any documentation, Trevor? None. So yes, if they, and we thank them for calling us to go and discuss. Let them work out on the issues that we told them. When they present them to us, if they're agreeable, we'll have a deal. For what we'll not agree, we'll still insist that this must be resolved.
Okay.
But what I'm saying is, in these 20 days, there's enough time. We were very, very considerate.
Okay.
If we'd given a 7 days notice to the country, it would have been inconsiderate.
Okay.
But we gave it 21 days, 3 good weeks,
Okay.
to discuss and resolve the matters.
Okay. So Panyako, come Monday, when you decide to speak about the strike, what kind of notice will you be giving? 7, 20 days?
We shall be giving 14 days notice, because that is what I've asked the National Governing Council to advise me on. And we will be laying bare our demands, which are known by everybody in this country. From 2017, we had a return to work agreement that the government and Council of Governors, led by a lady called Jacqueline Mokeni, will hear none of that. They went ahead even to stop those counties that had already implemented it. This time around, even if they get court orders, I can tell you for free, I'll go to prison, but there will be no turning back. Time for us to be respected and be given our rights, be respected and be given what belongs to us is now.
Okay. Gentlemen, thank you so much for speaking to us this evening. We'll see how this plays out. Dr. Mwachonda Chibanzi, Secretary General, KMPDU, Seth Panyako, Secretary General, Kenya National Union of Nurses. The doctors have 20 days. The National Union of Nurses, we will know come next week whether it's 14 days. Let's see what you're saying online. Let's bring them up to read some of the feedback. There's a lot coming through. I'll try and sneak in as much as I can here. Omide Daniel says, devolution of health is among the most progressive aspects of our constitution, as we know of the biases associated with centralization. Having Health Service Commission would mean returning health back to the national government. It's dangerous. Let's see what else Dr. Mwachonda refuses. You see him nodding his head. Kenyan Project, that's what you call yourself. You say, I don't understand why health workers are being made to beg for what are really reasonable demands. Seriously, I just want to sit somewhere and cry. Quality and adequate PPEs and insurance feels like pulling teeth. It's heartbreaking. All right, let's see what else you're saying here online. There's a lot of support for the doctors there. Mercy says, a soldier without an armor is a disaster. Let the Kenyan government do something to our doctors. They are fighting the battle. Let us support them fully. All right. Let's see what else you're saying here online. I'll try to sneak in as many of them as I can. Ole Carrington says it was inevitable that some healthcare workers would get infected with COVID-19. The infections are not a death sentence, and we've seen a good number of recoveries. The health workers should not raise the white flag in surrender. Okay. Let's see what else is here. Gashuhi Munywa says, what happened to professional ethics? COVID-19 is just an excuse. These selfish political strikes started long before COVID-19. I'm a 1986 registered pharmacist. I don't think my generation of medics would ever stoop as low as a strike. No, not for money. Dr. Mwachonda is itching to respond to that, but we'll see. Zablon Rina says, give the doctors what they deserve. Let's get our priorities right as a country. Make them comfortable. Let them treat our people. We can make Kenya a healthy nation. All right, let's see what else you're still saying here. Kefa Odhiambo says, is the union going to push for contract extension for the doctors on 6 months contract by national government? What plans does the government have to pay the COVID-19 contract doctors? They have been working tirelessly, risking their lives without pay. All right, let's sneak in a last one here because we run out of time. Job Otieno says, Kenyan doctors have really shown they are up to the task. They have risked and still risking their lives to help the nation during this pandemic. The government of Kenya needs to be serious for once and heed the doctor's plea. All right, that's where we leave it for now. My name is Trevor Ombija. We'll continue to have these discussions and allow you to ask the leaders the questions as and when is possible. Bye for now.